Welcome to Stop My Crisis. I'm your host, Vivian Gaspar. Do you love someone who's been diagnosed with cancer? We are so fortunate to have with us here today one of the leading foremost experts on how to handle that exact diagnosis. Here with us today, we have Dr. Ryan, who graduated summa cum laude from Georgetown University and Georgetown Medical School. He was a director in numerous cancer centers, including the highly renowned Dutch Heiser Cancer Center. Dr. Ryan is board certified in internal medicine, hematology, and oncology. He is now retired as a full colonel from the Air Force and professor of medicine at the University of California at the Davis School of Medicine. Thank you so much for joining us here. We, unfortunately, are very much in need of what you are an expert in.
Yeah, it's pretty common.
It's unfortunately too common.
Yes.
Tell me, first and foremost, about what made you write this amazing book.
Well, there was an incredible need that had to be filled. But before that, I would say that there was this drive inside of me to somehow do more and to somehow impart a greater meaning that would reach more people of the journey that I had been on, led by patients and colleagues and those that taught me and those that I taught. So the idea of doing a book was thrown at me a number of times in my years of teaching. And I kind of felt it was something that needed to be done, since there isn't one book that comprehensively covers all of what can happen when you're given the answer of cancer as your diagnosis.
Now, can I just say that I've looked through your book very much and very thoroughly, actually, and I've read it, and it's incredibly comprehensive. I mean, the fact that you cover the emotional standpoint of what the family members, not just the person who's been diagnosed, is extraordinary to me. I mean, first of all, this title is pretty awesome. When tumor is the rumor and cancer is the answer, what made you come up with that?
Because it's true. What happens as a result of some complaint that you don't pay much attention to, but you tell your doctor, or a laboratory test that they order and you think everything is fine, but they see some abnormality that it might be cancer, or other physical signs, or on a routine x-ray for whatever reason, tumor becomes the rumor. It's part of what's known as a differential diagnosis. And when cancer is the answer is who the targeted audience is for. Newly diagnosed, for their families and their loved ones, as well as the patient.
My mother has been diagnosed with breast cancer, and I have a very, very close friend who had throat cancer, and I really wish that everyone understood that regardless of where they are in that phase of between diagnoses and understanding the treatment options and how to even basically interact with their doctors, they really need to read this book. And I'm not just saying that because you're sitting here. If I was just speaking to a friend, I would highly encourage everything about this book. You did an amazing and impeccable job writing this. Congratulations. This is quite a legacy to leave.
Yeah, I'm glad that my mother was able to talk to you before you said all that. Because
I'm telling you, it's amazing. You're an accomplished writer in addition to, well, everything else. It's very, very impressive.
Well, it's music of the soul, the written word.
And also, I understand what the chapter that you wrote on having faith and incorporating spirituality into that. How does that make a difference on someone's success rate at work, beating cancer? I understand how you work with that concept.
Life without a spiritual influence, and I'm not talking about religion or theology, and I'm not saying they're not engaged. For some people, that is part of spirituality, but it's recognizing that you're more than a pound of flesh and a shank of hair, that there's so much more that makes you who you are. There's your purpose, there's your meaning, your ability to forgive, to show gratitude, to show grace. It's the feeling you get when you're part of a team. It's the feeling you get when you read inspirational literature, albeit religious or otherwise. It's the feeling you get when you have a hobby or you create something. It's the feeling you get when you build a journal, which is one of the most important things I tell my patients to do.
Wait, what
Write
kind
it
of
down.
journal?
A journal of their story. There's two kinds of journals. One I almost insist that they do, and it's you found out the rumor when, you found out the cancer when, what did you feel? What did you think? It helps them externalize what had happened so it can be more real to them instead of overwhelming, and to go through the process. The other journal that I really ask that they consider doing is get a hold of all the old photographs. Everybody has the old photographs, going back to grandparents. Get yourself just a simple cell phone or whatever, and record for your children, for your husband or your wife, or for your friends, your story. Just put a little number on the back of each photograph, take a little picture if you want of it, and create your own video analog of what it is that you've done with your life, and here you are now. That is one of the most blessed gifts you can give to anyone. So spirituality is extremely important. Without it, as you originally asked, despair, loneliness, lack of control, loss of hope. The opposite of that is when we face our fears, spirituality is focused and magnified, and it's an extremely important part of the care. When a patient involves that other aspect of what is holy inside that makes us human, when they do that, they're prepared for the fight. They're prepared to fully engage. They're going to be more compliant. Well, that leads to a healthier patient, doesn't it?
Well, I'm going to ask, speaking of which, you said healthier patient. You've seen thousands of patients that you've cared for.
Yeah.
Have you noticed a distinct difference between those that have practiced these suggestions that you've just made and those that just didn't want to?
Well, I'd have a qualified yes in that the other suggestions in the other chapters of the book, and if they read all of that so that they get all the knowledge of, well, what about clinical trials, Dr. Ryan, or what about the side effects, or what are the types of treatment, and how do they work, and tell me more about what cancer is and why it happens. What about the nurses in the front office and the inpatient centers, and and they go on, each one of which is a chapter. Those that do both, that get all the knowledge that's there, which I'm really just passing on, as well as expanding their spiritual life, they're going to do much better when they do both arms of it.
Because I heard that there's a lot, the reason I was asking if you saw a specific and distinct difference between those who practiced some level of spirituality is, I've heard that actually prayer helps. I mean, they've seen some kind of studies on this.
Sure.
So I was wondering if, an accomplished doctor as yourself has been practicing, and now you've actually, thankfully, put together this extraordinarily comprehensive book, what the distinctions have been between incorporating those spirituality tactics and those who don't.
More joy. More laughing in the exam room, no matter what the hell the news is.
Really?
Oh, yeah, absolutely.
You've seen people laughing in exam rooms?
Oh, absolutely. And
Wow.
I had even one patient fake a cardiac arrest so he could shoot me with a toy plastic gun.
I'm sorry, that's pretty funny.
And it's a story about the leprechaun's laser beam of life.
Yes, I was just going to ask you.
Yeah,
Well,
that's
mention
the story.
that. That's pretty great.
He was a little Irish character. He was funnier than hell. But they're less lonely. They're more compliant on telling you what's bothering them physically. They will also let you know with more feedback of how it's affecting their family. They're more willing to bring questions forward, and all that leads most likely to a better outcome. And if not, I question those who say it's not a better outcome when you have more happiness and joy in your life. When you're enrolled in a support group, the real message of which is what you bring to it, you'll then take away. The focus is to teach, to have a ministry of teaching to people who are very, very anxious. Turn that anxiety into fear by giving them knowledge. And one of the things that we do is I teach to do the KISS rule.
Oh.
KISSS. And that's an acronym for the things that you should do.
3 S's.
Yes, 3 S's.
Not 2 S's. Okay, so tell us what your 3S KISS is.
Okay. K is for knowledge. If you give the patient knowledge that is correct, comprehensive, and understandable, which means you must check in with the patient repeatedly as you go through the process of the journey to make sure they're understanding what you're saying. So knowledge. Knowledge can really calm the savage beast of anxiety. Puts the patient more in control because the patient's the one with the disease. The patient has autonomy. That's relatively new in the practice of medicine. It used to be that MD, magnificent demagogue, would be omnipotent and omniscient and omnipresent and would do whatever the hell they thought you should do, and the patient had no say in it because they knew better. Now that's largely faded away, but there's still a little hint of it. And patients succumb to that when they have let the doctor just kind of roll in and say all these things that have to be done, which isn't wrong, but not engage the patients to how they feel about it. So knowledge is the K.
All right, so that's the K.
That's the K.
What's the I?
The I is inquiry, to ask questions. There is no bad question, just as you know, the one you forgot to ask. So urging the patient to ask questions so they get knowledge. Inquire on everything. Who is this person? How are they part of the team? What do they do? What happens next? When do I get my next IV treatment? And on and on. Ask. and you'll start to create one of the other S's that I'll get to in a moment.
Okay, so that's K, and then
And
you have the
I,
I, and
right.
there's 3 S's.
That's right. Spirituality, which we've discussed at
Yes.
length. So as I mentioned, a hobby, be creative, join something that's a team is very important. Things that give you a sense of well-being, practice forgiveness, gratitude, grace. All of these things can be spiritual endeavors that really enrich the soul and empower the person. So that's the S. The second S is for scribe.
Oh.
Scribes used to be at the Pharaoh's footstool, you know, and would write down everything the Holy One said, you know, that the great Pharaoh said. Patients need to have someone who's very close to them and who can think calmly and clearly, write down everything the doctor says that's important in that first visit. Then when at home, write down all their questions. Bring them to the next visit. Then write down the answers that you had from that visit. You need a scribe, someone external to you that has got mastery of what the hell did he say? Because it's very easy for people to get overwhelmed and just oh, I can't swallow all this. You can if it's given to you in healthy doses over repeated time. I've even had an occasion when they didn't have someone in their family that could be a good scribe for them. I brought in a recorder. And the last one is synergy, and that's a word that means the sum is greater when it is a part of the whole, or the whole is greater than the sum of its parts. You need to build a team. You are the captain of the ship as the patient. The admiral that knows where all the lighthouses are and how overall things should move is the doctor and the team, but everyone has to be on a team. And the center of that team needs to be the patient and their loved ones and those that they're bringing into the diagnosis. It gives them control. It gives them hope. It gives them a feeling of mission, of purpose, of we're doing this for reasons that we all understand. And if it turns to the point where the patient has no reasonable further therapies allowed, then it really helps because they're connected to so many other people and they don't go through the process alone. And that's a very important issue as well.
That is really helpful information, and we're going to take a quick break, and
Sure.
we're going to be right back.
Are you disappointed by your tax returns? By maximizing your tax refund, you can look forward to less stress, more valuable life experiences, more stability. Kendall Ludden, tax preparer and refund strategist. He's here to help.
Welcome back to Stop My Crisis, and we're here with Dr. Kevin Ryan, the author of When Tumor is the Rumor and Cancer is the Answer. Dr. Ryan, please tell us more about this amazing book, and how does autonomy for the patient become a major aspect of this book that you wrote?
Yeah, it's a pivotal aspect of taking care of a patient with cancer, and frankly, any patient with any disease. If they have the ability to know and to understand, so you exclude patients that obviously have cognitive disabilities, and you exclude very young patients, but the vast majority of what's left, if they have the ability to understand, you need to reach them at that place. Autonomy was defined in the 1890s by the Supreme Court. It had to be, because doctors were busy telling people what they had to do as patients, sometimes saying why, but usually not, and they knew everything, and this is how it would work. They very well may have known everything, but it doesn't work as well compared to a patient who asserts their autonomy, as the Supreme Court said. The patient's the one with the disease. The patient has the right to accept or refuse therapy. The patient has the right to demand a rationale. The patient has the right to be informed. That's autonomy. When doctors don't do that, you have a real problem on your hands. Rarely medical legally, but you might. But more so, you have a problem with, you still have an anxious patient. And they just surrender themselves to you. Well, you're not them. You don't live their life. You don't know what's going to work best for them. You need to cross those bridges and connect.
Is there anything that you saw when you really interviewed thousands of your patients that there was a predominant theme that needed correcting and addressing the most?
It takes us right back to anxiety, and you have to look at the patient. They won't understand what anxiety is most of the time, because fear and anxiety feel the same, but they're not the same. So you can basically ask them, are you afraid? Tell me why you're afraid. Tell me what you think you know about cancer, what you think you know about this cancer, what you've heard from other people, because you know the rest of the world and everything that's past their eyes, movies, yeah, advertisements, internet, is all playing upon them. So you ask them, are you afraid, and if so, why? What do you know? What have you heard? What did other doctors tell you up until now? Because you know what the doctor said they said, but you don't know what the patient heard from what the other doctor might have said. So those are the things that you do, I think, initially. And you always introduce yourself, and you maintain a very careful clinical distance. And by that I mean the physical impression that you make upon the patient. You try to read them. Do they want you to sit next to them? Do they want you across the room standing? Do they want you more expressive? You can tell if you're sensitive to these things, and it can really build a bond where they can feel like they're coming in and not dreading it, but they're really looking forward to a very difficult experience, but they're looking forward to an interaction that is very rewarding for them.
What I love about your book, if I may say so, is I really think that both oncologists as well as people diagnosed with cancer and those who love them should both read, because I think it would really benefit both sides of the table.
That's why I wrote it.
Oncologists should be, or want to be, even better when how they interact with their patients.
Right, and in training situations, often the intern or the resident is going to be the first one to know that it's cancer, and they need to know what the limits of the expectations are for them, but there's certainly more than what many of them do, which is nothing. They wait for the oncologist to come.
Oh.
And that's understandable, because you have to answer the patient's questions. If you're the resident for a particular patient on your team in an academic setting, and they've had the diagnostic test and did it show cancer, you have to know how to handle that question, since you're not going to be the one that's going to be answering all the questions. The oncologist is. So it's trying to help them get a better understanding of how to practice, which is a good word, practice medicine.
What else, if I may say, that I love about your book is it teaches people who are living with cancer while they're getting treatment is the questions they might feel concerned about asking. You even bring up how to, sex.
Right.
The day-to-day life of normal human beings.
Right. Right.
And I think that's something that people might feel apprehensive, or they just
very much so.
It's off the table. I mean, I have cancer.
Very
I shouldn't
much
even
so.
think of this.
Now, it shouldn't be the first question to pop out of your mouth.
Well, no. I just was surprised to see a chapter covering that.
No, it needs to be done. It's part of, we're sexual beings.
Well, as human beings need to be addressed as a whole, because you're talking about,
That's right.
Alternative medicines and comprehensive care, but to also talk about and remind people it's okay to remember who you were before your diagnosis and what came up in your life. Well, sex came up in your life before you were diagnosed.
Right.
And you can't forget that that's part of being a normal human being.
That's right.
And I love that you care enough to address that.
Yeah, I try to go through that in detail, and I list in one of the chapters in terms of what can happen with chemotherapy or other types of treatments. Not everybody is going to get I hate calling them side effects, but you know them as side effects. An additional effect other than the one that was intended from the drug that they got, because they're all effects. There's no side, bottom, top, or under. They're all effects. And I go through listing all of them, but I make clear to the reader, you're not going to get all of them. You may get none of them. You have to know what some of them are so that you can recognize it and get with your doctor right away, so the treatment can be instituted to help treat you with those side effects. Many of them will just be silent. And they won't say anything. Thank God you asked them.
But it's really good to have that information.
Yes, it is.
Also gives you a sense of calm, I would imagine. Okay, so I know to expect this, and this can happen.
Right.
Dr. Ryan, this is really very helpful. I'm glad we're getting to understand more of what can happen. And of course, this book is phenomenal. We're going to come back in a moment. We're going to take another quick break.
Anytime you can come into court and file for a change if there's a change of circumstances. We give an hour free consult. It's confidential. Find out what has to be done.
Welcome back to Stop My Crisis. We are here with Dr. Kevin Ryan, learning more about how to handle the situation if you're diagnosed or someone you love with cancer. You have written this phenomenal book. Please tell us a little bit more about what's covered in the table of contents.
Sure. There's a lot of chapters. There's 26, and I'm not going to recite them all now. But it starts out with what I call read the directions first. And I'll only highlight the important ones. That one is crucially important. Your mother told you that, your father told you that, your grandparents told you that, God said it to Adam and Eve supposedly. Read the directions of how things work first. What I used was the metaphor of making a wonderful, delightful, joyful concoction in the kitchen of your heart. And I call it making a recipe. Call it the sweet life. And I borrow from every sage and religious leader and philosopher loosely, like a pound of purpose and, meaningful memories of meat, things like that. I have put together a concoction of the joyful life. This is what it consists of. Read the directions first. That's the first chapter.
I've got to say, I really love that you're very inclusive. Because so many people go in just a one direction, figuring, well, there's enough population percentage in this direction. The rest can just, learn to live with, including themselves somehow.
Sure.
So the fact that you deliberately set out to write it in a very all-inclusive manner, good. Kudos to you.
Well, thank you. Autonomy comes next. We talked about that. Anxiety, we talked about that. The nuts and bolts of oncology, they definitely have to read that, because how do we talk? What do we mean? How do we label? What caused the cancer? How do you prevent cancer? And the list goes on the nuts and bolts. Then we have suspecting the diagnosis of cancer, which is very different than being diagnosed. They're different. One is the lead up, and there's different tests and evaluations and emotions, and the other is the actual diagnosis. And there's a lot of subheadings to that. I go through the various treatments that are available, through what makes an oncologist, as we mentioned, the problem of pain, which is a problem. It's a problem that most people think they're going to have pain because they have cancer. Not always, and the vast majority of times that pain can be controlled using modern, knowledgeable, multimodality types of approaches. It then talks about clinical trials and the beauty that they bring to us knowing what we know and knowing that we know it to be true instead of a best guess. That's pretty vital information. And so toxicities of therapy wind in there. Then we go through the inpatient experience, the outpatient experience, dealing with the nurses, and then it winds down looking at spirituality, self-talk, very important. As you think, you will feel. That's basically cognitive behavioral therapy. In plain English, that means thoughts drive feelings. It's not the other way around. If someone is standing outside your door holding a gun at you, you're going to be afraid. Why? Because you thought about a gun and that you could be hurt, not because you just felt it out of the blue. Thoughts drive feelings. What if it was Halloween and it was a toy gun? Thoughts drive feelings.
Well, I always hear the phrase, you choose to be happy or you choose misery.
There's a lot
choice.
That's right. There's a lot of truth to that. And so we talk about that. Then the use of the internet, complementary and alternative medicine, and the role that it has and the roles that it shouldn't have. And we talk about medical legal aspects, and we talk about ethics. Things that you don't find in one book. I try to cover the entire journey for when tumor is the rumor and cancer is the answer.
What about preventative measures for some types of cancers?
Well, we have screening for a bunch of cancers that have now been statistically shown to make a difference, and there's new recommendations coming out every couple of years on additional cancers. There's some antiviral vaccines that are out there for human papillomavirus type 2, which
HPVs,
right, have head and neck cancers and cervical cancer, and as well as anal cancer. There aren't too many other preventative vaccines. The diet, we know, is very important. Not the extreme things you may hear, but the diet of avoiding certain foods on a high volume, constant basis can definitely be of help.
By the way, the HPV vaccine you were mentioning you should really have when you're a child.
Yes, in the pre-adolescent, or in the case of boys, adolescent years, yes. That's when it seems to have the most amount of efficacy, both sociologically as well as physically.
Great. So that's really important for people to know that, these types of preventative measures isn't cookie cutter. You have to know when to do what.
Right. And there's an entire chapter that goes through preventive measures and what they've been shown.
So to me, that means that everyone should read the book, because even if you don't have a current diagnosis or someone you love, you really should understand about what is the preventative measure you can have for yourself or your family.
Yeah, it's not a principal thrust of the book, but it is definitely there because it's part of the continuum.
So you really know how to help your children or children you love. And with that, we're going to take one final break and be right back.
Roughly half of Americans are concerned about their financial well-being. Nearly a third of Americans have less than $10,000 in savings. Last year, 77% of taxpayers believe they benefited from using a professional tax preparer. Are you worried about your financial situation? It only takes one snowflake to cause an avalanche. Don't let taxes sneak up on you this season. Kendall Ludden, CPA, tax preparer and refund strategist.
Welcome back to Stop My Crisis. I'm here with Dr. Kevin Ryan, and he has authored this extraordinarily comprehensive book. Dr. Ryan, please tell us more exactly what is in this book that people really should be aware of and why they should get it.
Comprehension is pretty important when you arrive at a diagnosis of cancer. When you start with the rumor of it, as we've discussed, and it turns out to be the actual diagnosis, that opens up an entire bag of worms. When I first thought that I would be doing this, because I'd had a lot of fellows and residents, interns, and especially patients say, have you written this down somewhere? Are you writing something? Because they could kind of tell that was something I liked to do. And I had snippets here and there. I went to a couple of bookstores, went to the largest one, and looked at all the sightings that they had online as well as hard copy about cancer. There was not one book that was comprehensive of the entire journey when tumor is the rumor and cancer is the answer. I couldn't find one. I've gone back a couple times, I still can't. There's I'm Joe's liver cancer, I'm Sally's breast cancer support groups, lymphomas or just leukemias, and so on and so forth. But none that was a Bible, basically, where this could take them all the way through the journey. I remember I was getting a little teary-eyed when I saw, yeah, the need is there, you can't run away from this, you know. You're being called to do it. You can't run away. And I turned to my wife and I said, I can't believe I'm going to write a cancer book. And she gave me a hug and a kiss and said, you already are.
Oh, I'm so happy that you have that level of support in your life.
Yeah.
And I really believe that when someone has that kind of support, it helps them do what I believe that they were destined to do.
Yeah.
I mean, if you think about how many people have been and will benefit from reading this book, that really should choke you up, because now you're seeing a huge ripple effect. Because when someone reads a book like yours about how extraordinarily comprehensive it is, they don't just read it for themselves. They read it to take care of others. They read it to pass on to others. They read it to tell others. You're creating this enormous ripple effect, and it wouldn't be happening if you didn't have the support system you do.
Yeah. Well, I'm very fortunate. I'm very fortunate in that regard. The last thing I wanted to say is that the website, which has the same name as the book, www, of course, When Tumor is the Rumor, Cancer is the Answer, all no spaces, .com. Website gives away a lot of things simply for free. It takes you through the book. It gives you excerpts of stories, of anxiety is on there, read the directions first is on there, table of contents is on there, a whole bunch of videos that I made. So it's to be given away for free. And I'm not making any money on this. All the proceeds go to the American Cancer Society. I couldn't imagine trying to make money on this. I wouldn't be able to live with myself, because that's not why I did it. I did it for the people who have tumor is a rumor, and eventually cancer is their answer. That's why I did it.
Well, I, for one, not just want to thank you for doing what your calling is and writing this book, but of course also thank you so much for your military service.
Thank you.
And I really appreciate it, because I think not enough people can appreciate when somebody like yourself has stepped up in such a huge variety of ways. I mean, you really are a real exemplification, I don't want to sound cliche, but an American hero, to give so many people such knowledge, hope, and understanding. And thank you so much for being on this episode of Stop My Crisis. And I'm sure as millions of people will watch, that many people will get help from knowing that your book is a fantastic resource.
Well, thank you, Vivian. I enjoyed my time.
Thank you so much. And this is how you stop your crisis.